340B dollars are wasted. Where do you want to start on that one?
This is one where, and I know we'll talk about reform in a little bit, but where I just wish that we had been tracking this data better since the first day the program started, because the stories that we get from health centers about what 340B enables them to do are incredible. And there is not, I mean, you always talk about community health centers doing more with less. There is never a penny wasted at a community health center. Like, they are going to squeeze everything they can out of it. So every dollar of 340B savings goes back into expanding clinic hours, building a new site, keeping sites open. But I do think that it's on us as the entity to show that, to really show it in numbers and dollars and cents, because people haven't set up the tracking systems because it was never required. So it's hard to then go back and rejigger some of that. But I think we have to be able to show it, because I think we've been saying for years, like, believe us, we do great things with this. And I think it's time to, like, put our money where our mouth is. But all of the services that people are able to provide because of 340B, if 340B went away, those services would go away, or taxpayers would have to fund them. Like, these are services that are, don't use a dime of taxpayer dollars. So I just think we need to be careful going down this path about what these dollars are used for, because it may come back with just us going back to Congress and saying someone has to pay for this care.
Yeah, I mean, I think the other thing, so I wholeheartedly agree with you, and I think ACH certainly has been supportive through our 340C proposal, but I think in general of, like, look, let's do a better job of tracking and you know, the transparency and the accountability. But I also will stand up very proudly and say that health centers track every single dollar that goes through their system.
Yes.
So whether you can attach that 340B dollar to a specific X, Y, or Z, that may be harder, but I know very confidently that it is going into expanded access to care, whether that be, to your point, in terms of standing up a new site or maternal health services, which are one of the first ones to go. Unfortunately, if you see reduction or loss in 340B dollars, like, that is a service that unfortunately does not have a lot of support. And so that's really the only way that a lot of health centers are able to continue to provide that care. But to your point, I don't think either one of us can speak to the expansive sort of community that exists within the 340B space, but I do feel very strongly and very confidently about what we just said about health centers specifically. And so that one is not just frustrating, but I think even the data that we have backs up the fact that this isn't waste.
Right.
It's not, the margins are 1% to 2%.
Yeah.
Most people working in a community health center can go choose to work wherever they want elsewhere and make more.
Yes.
They're there for a reason. And so it's a little offensive when I hear that, but it's personal.